We know that Borough President Vanessa Gibson has really placed a strong emphasis on maternal health and the health of the newborn and infant and children. So please take it away.
Thank you so much, Charmaine. It's truly an honor to be with all of you this morning. I just want to echo your sentiments from your opening remarks and recognize Ms. Teresa Lando, who is a great partner and a staunch advocate for breastfeeding and accessibility to services and care for Bronx mamas. I mean, we've been working for many years, well, before my time with the borough president during her city council years. But I had the honor and pleasure of collaborating with Teresa, and the work that's being done over at the center is just transformative and so necessary and life-saving, not just for Bronx mamas, but for the next generation of Bronxites and Bronx residents. So I just wanna thank you, Teresa, publicly. And I see many of our partners, like Anita Reyes, Assistant Commissioner of the OHMH. Again, Anita, when we call, Anita's always present. So I'm just super excited to be on this call and really an honor. And just to touch really quickly, and I'll touch on this on my remarks, Charmaine, you mentioned environmental justice and transit equity being a part of it. We cannot have this conversation around equity and transforming access for breastfeeding and maternal care without really addressing the environmental injustices and transit inequities in our borough. I mean, I'm currently an expecting mama. I'm currently pregnant into my second trimester, leading into the third trimester. So all of this is truly personal for me, but for the women that I know, how difficult it is to just access care and access the right care and access the diversity of care that the Bronx has to offer. You know, we are a borough with one of the highest maternal mortality rates, but we have the lowest access of diverse accessibility from not having a birthing center or just not having that diversity of choice, right? If a mother wants to go to a birthing center, she has to travel many, many miles or travel out of borough, travel out of state to access that. And that's not what we want as a borough. And so, as you mentioned, my current role is to serve as the Deputy Bronx Borough President and really carrying forth the blueprint of the Vanessa L. Gibson administration, our borough president. And again, it's truly an honor to be with the Bronx Health Reach, with our U.S. Department of Health and Human Services. It's so great to see the state so involved. I think, I don't want to say that this is the first time, but I'm just seeing in government how different levels of government are really, really taking this issue serious and really taking the Bronx serious. So to see representation from the federal government, from state government and local government in one call this morning really just speaks to everyone's commitment to not just having this conversation, spreading awareness and ensuring that resources are reaching our borough. And so, as I mentioned, maternal health is a huge pillar of the Bronx Borough President's health agenda. And as I mentioned, as a woman of color, as a woman who is expecting, this issue is very, very personal to me. We know that maternal mortality rates in the Bronx are far higher than any other borough in the city, and let alone the state. And so further, the data reveals that Black and Hispanic women are alarmingly more likely to die of pregnancy-related causes than our white female counterparts. And women of color in the Bronx are, as we mentioned, burdened by numerous social barriers to health. We struggle with access to quality healthcare services, and we are at significantly higher risk of pregnancy-related complication and deaths. And so the data is gruesome. The data tells a story, a sad story, but the data also gives us awareness of what we need to do. And the intersectionality between government and healthcare is more crucial now more than ever. And so to address these complex barriers, we must work with one another, from whether it's advocating for discretionary funding, capital funding, policy changes, legislation change, at all levels of government know that you all have an ally and a supporter at the Bronx Borough President's Office. This is something that we're taking really seriously. We launched the Bronx Maternal Health Consortium, and that's really designed to develop legislative action, access, and unveil the real data that's out there and what does that mean for our borough. We're also advocating for additional funding opportunities, patient education, and again, addressing transit inequities, transit barriers, et cetera. But something that we're currently working on is developing a report on maternal care really focused on the Bronx. Like, we talk about these numbers, we talk about the greater issue, but why is it that the Bronx is faced with these mortality rates and the percentages of women that are not educated in wanting to breastfeed, right? Like, what are the root causes of these issues? And that's what we're really trying to hone in on. And so, you know, our goal is to promote preventative care, education. As Erin mentioned, I too will be at the March 28th event. Again, just to encourage and just build awareness around that. If there's any way that I can help promote that event even further, whether it's working with our community-based organizations or our local stakeholders, happy to do that. But I, again, personally wanting to breastfeed, but understanding that we must combat that stigma and also understand what are the barriers to care. And so I know that, you know, collectively we will affect change because we're all super passionate. The folks that are on this call have been doing this work for many, 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 many years. And I also want to acknowledge the anecdotal piece of it. I'm currently, you know, under a Black OB's care, right? Because of the fear of surrounding the data. I was very intentional around who I wanted to be under the care of. And I went above and beyond to ensure that I had care from a woman that understood kind of like my emotional challenges and my cultural fears. But one of the things that my OB mentioned when I'm going through, you know, all the symptoms and everything and all the side effects, she's like, talk to your grandma. Talk to your grandma. She'll know more than, you know, and my grandma had 12 kids, so she's right about that. But, you know, it's that collective approach. We can't do this in silos. We must cross-collaborate. We must support one another. And Teresa knows that, you know, we're gonna figure it out, even if we don't have the tools and the resources in our toolbox at the Bronx Borough President's Office. We know another elected official who may have that. We know another level of government who may be able to support. And that's the work that we're doing here. That's the work that we're committed to. So once again, I want to thank the Bronx Health Reach for inviting us to this very important discussion. I want to thank each and every one of our healthcare providers, our community advocates, our community leaders, our families, our birthing warriors, our doulas who are so important. I want to give a shout out to the Womb Bus as well, the Bronx Birthing Center, again, for their years of advocacy. I don't think our community leaders get enough credit for the work that they do on the ground. And so once again, thank you so much for this invitation. I'm happy to stick around, but our mission and our goal is to continue to support the really good work that's being done on the ground. So thank you again for the opportunity to be on this morning.